Let's move on now and talk about how vaccines work. Vaccines can be deposited either in the body or on the body. You're probably aware of the fact that there are some forms of vaccines, such as the influenza vaccine, that can be sprayed up into the nose, for example. Most vaccines we think of as being injected into the body, either into the subcutaneous tissue of the skin or even into the muscle, depending on the vaccine. Remember, inside that vaccine is some form of the causative agent, the pathogenic microbe, and that form contains antigen. Once it's in or on the body, those antigens are now exposed, and that is going to trigger the innate immune system. And as we discussed in the Introduction to Immunology lecture, when the innate immune system encounters the antigens, it's going to set off the innate immune response, triggering an inflammatory reaction within minutes to hours after the time of vaccination. And the inflammatory response will ultimately help destroy the material. In addition, cells of the innate immune system are going to process some of the antigen and present it to cells in the adaptive immune system so that antibodies will be made against those antigens and memory will be gained. So vaccination, by definition, is going to elicit an immune response, and it's going to result in the production of antibodies, all the while without causing disease. However, we've learned through trial and experimentation that the antibodies that get produced after a single immunization are often not sufficiently protective against that pathogen over long periods of time. In order to achieve lasting immunity, we have to receive these immunizations in multiple doses. And even after the multiple doses, we have to then get what we refer to as booster vaccines periodically throughout our lives. Having this multiple injection system is going to do a few important things for us. In other words, getting a vaccine more than once is going to achieve a couple of important things. First of all, it will produce more antibodies than a single injection would. Second of all, it's going to produce better quality antibodies with, importantly, a higher binding ability. Remember, those antibodies with their FAB regions are going to be able to bind very specifically to the antigen in that pathogen. We need those antibodies to have a high binding affinity or a high binding ability in order to do that as well as they can. Finally, using multiple vaccinations, the immune memory that will be produced against that pathogen will be improved. In other words, when the person gets exposed to that pathogen, their response, their immune response will be quicker and more effective. On this slide, you can see a graphic representation of the importance of boostering vaccines. In other words, giving them in more than one injection. On the x-axis, you can see time going by, days going by, after the original vaccine, the original exposure to the antigens of the pathogen. On the y-axis is a representation of how much antibody is being produced, with low levels down here and higher levels up here. So you can see on day 0, this dotted line indicates that this is the day that the first vaccine dose was administered. And over a period of approximately 2 weeks, a good number of antibodies will be produced. So it's important to remember that after the initial vaccination, antibodies don't appear overnight. The adaptive immune system takes time. So it takes, again, typically around 2 weeks to see the production of antibodies begin. Or I should say, the production of antibodies reach a peak. Now notice that from that 14-day or so period, the antibodies start to drop off almost immediately. So that when you get out to about 3 weeks, you're still better than you were at the very start in terms of having some antibodies, but you don't have very many antibodies after that first injection. This is when the time is right to booster the vaccine, to give a second injection. And what will happen then is you will have a second production of antibodies that will achieve a higher level than the first vaccine did. And those antibodies will last for a longer period of time. Now, yes, they do drop off, but when they level off, you have a decent amount of antibodies circulating, if you trace that back over to the x-axis, much more than you did at the time of the first injection. Now, some vaccines only require 2 doses, but it's an unusual vaccine that doesn't require a booster down the road as well. In other words, you might need to get a dose and then 3 weeks later a second dose, but then you might have to come back next year or in 2 years or 5 years or 10 years and get a booster. It all depends upon the vaccine. I want to switch gears now and start talking about adverse reactions to vaccines. Adverse reactions to vaccines are not uncommon, but it's important to know that the vast majority of these reactions are not particularly serious, and the risk of an adverse reaction is much lower than the risk of not getting vaccinated. Generally, when we speak about vaccine reactions, we break them down into one of 3 categories. What we call common adverse reactions, the less common adverse reactions, and the rare and severe adverse reactions. These are categories that are used by, for example, the Centers for Disease Control to describe the types of reactions that we expect to see. You have to remember what a vaccine is doing. It is stimulating the immune system in the individual. And as we discussed when we talked about immunology, it is the immune system that is producing these chemicals called cytokines that contribute to that sickness feeling that we have when we have an infectious disease. The fever and the malaise and the muscle soreness and so on are all part of the normal immune response. So what we see in terms of adverse reactions, a lot of it relates to the normal immune response. For example, common adverse reactions from vaccines include fever, redness and swelling and discomfort at the site of the injection. Now, by common, I mean approximately 1 out of 4 individuals will experience these common adverse reactions. And again, these reactions are directly related to the immune response. This is an inflammatory reaction, the redness, the swelling, and the discomfort. And the fever is a result of those humoral immune chemicals being released. In the less common category, and by less common we mean approximately 1 out of 15,000 vaccinations, the fever gets out of control. So you get a high fever as an adverse reaction, and depending upon the age of the person being vaccinated, high fevers can trigger seizures. In infants and young children, high fevers can trigger seizure activity that you won't see in older people. Now, these seizures, while they are terrifying to view as a parent, are not particularly serious in that they usually resolve when the fever goes away. So yes, febrile or fever-associated seizures are very, very scary to watch. They are not considered dangerous to the child as long as the fever is brought under control. In the rare and severe category, we're talking about approximately 1 out of 1 million vaccinations. And in this category, the adverse reactions are severe allergic reactions. And by that I mean anaphylactic type reactions, where the person's throat closes up, they can't breathe, their mouth and other respiratory tissues swell, and their life is in danger. Ongoing seizures are in this list, and of course death is in this list. Now, when you look at rare and severe reactions, these are also related to the immune system, but these are abnormal immune responses. In other words, it's not normal to develop a very high fever when you get a vaccine, but some people do. And as a result, they can have ongoing seizures. It's not normal to have an anaphylactic reaction to a vaccine, but some people do. And unfortunately, the combination of these things can lead to the death of the person being vaccinated. And yes, people have died from vaccination. People do die from vaccination, but it's a very rare occurrence. So it's important to know that most adverse reactions to vaccines are not the vaccine causing that problem, but the response of the immune system to the vaccine. In other words, the vaccine doesn't cause the seizure. The vaccine is not causing the pain and so on. The immune response to the vaccine is causing those adverse reactions. We are trying to stimulate the immune system with a vaccine, and we want a good, strong immune reaction to a vaccine. That means there's going to be humoral chemicals released, there's going to be cytokines released, and we're going to get things like fever and pain and swelling and redness at the injection site and general fatigue and malaise in some people. Severe allergic reactions, and again by that I mean anaphylaxis, is typically due to the immune system being allergic to something in the vaccine. And that's often either the preservative, an adjuvant that might be in there, or some other product in a vaccine. For example, some vaccines against viruses are produced using eggs, using chicken eggs. Remember, viruses need cells in order to get their genetic material copied and their proteins made. So when we're growing up viral particles, we need cells to do that. And chicken eggs have been used historically to help grow up um, viral particles. There are some people who are allergic to eggs and egg products, and so they cannot receive any vaccine that was grown up in egg, or they will have an anaphylactic reaction to it.